Hello, my name is Brennan Powell, and this is my presentation for the Drugs and Behavior class at Georgian College. Throughout this presentation, I'll be going over various reasons why the creation and implementation of safe injection sites are beneficial to our society. Hospitals are currently facing a staff shortage, specifically in nurses. The National Library of Medicine says an aging workforce, nurse burnout, and turnover rates is to blame for the shortage. There are many people that are taken to the hospital every day due to overdoses and require the attention of a nurse, as well as other staff. The Canadian Centre on Substance Abuse published the statistic of the number of hospitalizations due to opioid poisoning, and it increased by 30% from 2007 to 2015. In 2014-2015, there were 4,779 hospitalizations due to opioid poisoning throughout all of Canada. Safe injection sites aim to reduce overdoses, which can help reduce hospitalizations and will allow the hospitals and staff to receive less patients per day. Safe injection sites have the goal of preventing overdoses. Overdoses can be deadly unless given naloxone, which rapidly reverses the opioid overdose. Safe injection sites have trained staff prepared with breathing masks and naloxone in case of an overdose, where they are immediately able to give the user the drug to revert the overdose. If the user were to overdose elsewhere, likely no one would be around to give them naloxone, or if they were to be found and taken to a hospital, it could be too late. Another common health implication for drug users is using dirty needles. Using dirty needles can lead to HIV and skin infections. For that reason, at safe injection sites, they provide the user with a new, clean needle to reduce the risk of harm. Community safety has to be the number one priority when beginning to put up a safe injection site. If there have been recurring issues by a number of members in the community due to drug issues, something has to be done to prevent that from happening. Living in an area where there are people under the influence of illicit drugs is very difficult and dangerous. Needles are typically left scattered all over after being used and can cause a serious risk, especially for children and pets. Safe injection sites get people off the street and into a facility where they can use their substance away from the general public. The needle can be properly disposed of, and they cannot bother people while they are under the influence. In an article by Laura Huey of Western University of Ontario, wrote about how many people don't want to go downtown or take their children into parks due to them seeing people using drugs as well as the mess made from their needles. Safe injection sites can help clean up a city because it gets people off the streets when using substances, and the equipment can be disposed of properly. Safe injection sites are the stepping stone for those seeking help. It's the first place for them to go and receive help, as well as information on how to get more of the help that they need to get clean. They're able to talk to the trained employees and give them all the information that they need, and give them brochures and any other information that they have. They are able to point them in the right direction of getting clean and can help motivate them to do so. The employees try to build a relationship with the users so they can build trust and try to get them better. Proponents of safe injection sites say that these facilities save lives and provide addicts with healthcare services and opportunity for detoxification and social rehabilitation, according to the National Library of Medicine. In conclusion, safe injection sites will help the healthcare system as a whole, as there will be less people coming into the hospital because of an overdose, which will put less stress on the healthcare system. These sites will prevent and reduce overdoses. They will also ensure the safety in our community by having a place for addicts to use these illicit drugs, which will help clean up the affected communities. And most importantly, the people who need the help are able to get the information they need to get clean.